hope you're doing fantastic. I'm going to be making reference to the Diagnostic Statistical Manual, as I would like to talk a little bit more about the autism spectrum diagnosis and the process. So in order to undergo or receive an autism spectrum diagnosis, one needs to take their child to a neuro psychologist or a clinical psychologist who will then assess the child. The assessment, it can be done over a couple of days depending with the clinician, and they render a lot of assessment batteries, and they are also looking for some of the criteria that I'm going to be mentioning here. So one needs to be presenting with some of the symptoms here. So you need to meet the criteria A, criteria B, and criteria C, and I'll explain a little bit more regarding some of the specifiers. So allow me to kind of read, as I'd like to give accurate information from the DSM here. So for criteria A, the child needs to be presenting with persistent deficits in social communication and social interaction across multiple contexts. And some of these will be deficits in social emotional reciprocity, deficits in nonverbal communicative behaviors used for social interaction, deficits in developing, maintaining, and understanding relationships. And then criteria B speaks to restricted, repetitive patterns of behavior, interest, and activities, and you must manifest at least two of the following: stereotypical behavior or repeated motor movements, such as lining up toys, flapping objects, echolalia, or idiosyncratic phases. And then insistenceness of sameness, inflexible adherence to routines, ritualized patterns. So this may be difficulties with changing even diet, changing foods, requiring the same kind of things every time. And then highly restricted or fixated interests that are abnormal in intensity or focus, strong attachment or preoccupation to unusual objects. And the other one is hyper or hypo activity to sensory input or unusual interest in sensory aspects of the environment. So it can be apparent indifference to pain or temperature, adverse response to specific sounds or textures, excessive smelling, touching of objects, visual fascination with lighting, with lights or movement. And then all these symptoms must be present in an early development period, but they may become fully manifest until may not become fully manifest until social demands exceed limited capacities, or may be masked by learned strategies in later life. So symptoms cause clinically significant impairment in social, occupational, and other important areas of the child's functioning. So these disturbances are not, to meet the criteria of autism as well, these disturbances are not better explained by an intellectual disability and developmental disorder or any global developmental delay. So important to note that intellectual disability and autism spectrum disorders frequently co-occur to make comorbid diagnosis of autism spectrum disorder and intellectual disability. Social communication should be below the expected or general developmental level, right? So some of the aspects that you may note, they might be diagnosing a child with autism spectrum disorder with or without accompanying intellectual impairment, or they may issue with or without accompanying language impairment, or associated as a non-medical condition or environmental factor, right? So these are some of the things to be mindful of when you're undergoing the assessment, that they do render quite a rigorous assessment, and they will engage with various sectors such as the education, caregiver feedback, all the people that are significant that might give better insight, might receive some skills in order to gain insight into the presentation of the child across the different environments or domains. And then you can speak to your diagnosing practitioner to gain a better understanding of what kind of intervention the child may require. If you have any questions, please do not hesitate to contact me. Thank you. That's all we've got for today. Cheers.